All right. Very good. Again, thank you guys so much for being here today. As I mentioned, my name is Tina Wahardo, registered dietitian and health educator with Bronson Community Health. And today, November 30th, on our virtual healthy living class, we are connecting you guys with a lung cancer awareness class. And today we have two very special guests with us. Dr. Mohammed Usman and Dr. Natasha Dhawan with us today that are going to be speaking on the topic of lung cancer, as November is Lung Cancer Awareness Month. We are going to go ahead and get started. So if you've been to any of our healthy living classes in the past, you know the drill. We've got closed captioning available on your Zoom account, and that is set for you. If you need to activate that, just go ahead and click the little CC button at the bottom or top of your screen so you can see the text that is being said. It may not be 100% accurate. However, if you ever need any clarification, just go ahead and type your question in the chat and we can clarify that for you. We do ask that you remain muted for the entirety of today's session, just so we can decrease any background noises or disruptions. And today's recording is going to be recorded. So I do understand if you would like to remain off of video for the sake of the recording. However, we also love to see your smiling faces this morning as well as we interact in this class. Today's class, as I mentioned, is going to be lung cancer awareness class. And we are going to have our presenters discuss on the topic of lung cancer. And during that recording, at the end, we will stop that recording and allow you to have some question and answer time. So after I stop the recording, please do not leave the class. That is going to be your opportunity to ask questions of our speakers. Please feel free to utilize the chat as we move through the class today and ask your questions throughout the session. Just know that we will address those questions at the very end. Again, thank you guys so much for being here. I will now pass it on to our speakers.
Perfect. Thank you so much. So again, I am Dr. Dhawan.
Hi, I'm Dr. Usman.
And so
Thank you for joining in.
Thank you. So we're just going to take this opportunity to go over an overview of lung cancer and some common signs and symptoms to look out for, factors that may increase or decrease your risk of developing lung cancer, broad strokes of how lung cancer is treated, and how to find a provider and other resources on lung cancer. Next slide. So what is lung cancer? So lung cancer is a type of cancer that starts in the lungs, and it can travel to any part of the lung, and it can also travel to other parts of the body. So sometimes people may have lung cancer that's traveled to, for example, the liver. We still call it lung cancer, but just that it's gone to another organ in the body. Cancer starts when cells go haywire and begin to grow out of control. It's the second most common cause of cancer in both men and women. Next slide. So the types of lung cancer include non-small cell lung cancer, which is the majority of lung cancers that we see. About 80 to 85% of all lung cancers are non-small cell. The second type of lung cancer is called small cell lung cancer, or sometimes it's called oat cell cancer. That's more of something that we used to call it. That's about 10 to 15% of the time of lung cancers is small cell. Small cell lung cancer does tend to grow more rapidly compared to non-small cell. So we try and get people both seen by a provider and also treated as soon as possible. And the third type of lung cancer, which is the least frequent, is called carcinoid tumors, which is less than 5% of all lung cancers they tend to be more slow growing compared to the other two. Next slide. So in terms of risk factors that you can change, the most common is smoking. I would say smoking is probably number 1, 2, 3, 4, 5. The most common risk factor and the largest risk factor that's within our control is either you smoking or being exposed to other people smoking, which is secondhand smoke, in terms of reducing the risk of lung cancer. Other risk factors include exposure to certain substances like radon, asbestos, like in old homes, diesel exhaust, coal smoke and soot, and high doses of supplemental beta carotene. Next slide. The risk factors, unfortunately, that we can't change are things like air pollution, having a previous cancer and being treated for previous cancer can also increase your risk. Hereditary factors, prior radiation to the lung, and a history of COPD or pulmonary fibrosis. Next slide. So some early signs and symptoms that you can look out for in yourself or your loved ones for lung cancer include cough, changes in voice, rust-colored spit, shortness of breath, feeling tired, repeat lung infections, loss of weight and appetite. So as you can probably tell, these symptoms are pretty vague in nature. So we always need to be mindful of shortness of breath may not necessarily be lung cancer. It could be a viral infection, like especially nowadays. But it's about kind of making sure that we're looking at the big picture and looking at all the symptoms that a person might be experiencing and putting it all together. Next slide. So some later signs of lung cancer include chest pain and chest tightness, swallowing difficulties, blurred vision, headaches, swelling in the head and neck. These are more so common if the cancer has spread to other areas. You might see some of these signs and symptoms. Next slide. So part of what I was referring to earlier in terms of the risk factors that is within your control is the smoking. So this is probably, and I'm a lung cancer doctor, so I feel very strongly about this. And I talk to all of my patients about this, whether I'm seeing them for lung cancer or not. But the most important thing that you can do is get screened for lung cancer if you meet the recommendations. So if you're between the age of 50 and 80, and if you currently smoke, or if you used to smoke, but have at least a 20-pack year history of smoking, you should get a low dose CT scan of your chest. And that's essentially, it's low dose means that you're not getting as much radiation as you do with a normal CT scan, because we want to limit the amount of radiation that you're getting, but also it's the benefits of screening and catching lung cancer early is of the utmost importance, because if we catch it early, we can treat it faster, we can treat it easier, and it's the best chance for a cure. Next slide. So how do we treat lung cancer? So these three, I call them buckets. It's essentially 3 buckets of treatment. So one is surgery, the next one would be radiation therapy, and the third one is systemic therapy, meaning therapy that kind of goes all over your body. So the surgery would be targeted to one area in your body. The radiation is also targeted to a certain area that needs radiation. What we do as medical oncologists is the third bucket. So that's the chemotherapy, immunotherapy, and targeted therapy. And happy to go into more details of what that is if anyone's interested. But I can save that for later in the Q&A if anyone's interested in knowing more about what those three therapies include. Next slide. So what determines lung cancer treatment? So as I talked about, there's three buckets. Not everyone needs all three buckets, depending on your symptoms, depending on your age and overall health, the type of lung cancer you have, the size of the cancer, where it's located, the tumor molecular makeup, and also your own personal preference determines which of those three buckets will lean into to determine what type of treatment to provide you or provide someone. Next slide. So how to lower your risks. As I said before, smoking is the best way to lower your risk for lung cancer and many types of cancer actually. Stopping smoking and decreasing any exposure to secondhand smoke is the best way and the most effective way of decreasing your chance of lung cancer and many other types of cancer. Other ways to lower your risk is avoiding radon and other chemicals that may cause lung cancer and eating a healthy diet. Next slide. In terms of finding a provider, so we both work at the Kalamazoo Bronson Oncology and Hematology Specialist in the Kalamazoo office, and we also have a Bronson Oncology and Hematology Specialist clinic in Battle Creek. The addresses and phone numbers are listed on the slide. I was going to give them 1 second if they wanted to write it down. Sorry. Okay, next slide. Perfect, thank you. And if you are interested in getting more information on lung cancer, these are some great resources to look up on, for more resources on what lung cancer is, treatment, cancer support groups, research, and even financial support as well. So there'd be Longevity Foundation, the American Lung Association, the American Cancer Society, Smoke Free Online Program, and Lung Cancer Research Foundation. Oh, perfect. Thank you so much for putting that in the chat. Next slide. So what did we learn? We talked about what lung cancer is. We talked about broad strokes of common signs and symptoms to look out for, factors that can increase or decrease your risk of developing lung cancer. Biggest take-home point is decreasing exposure to smoking and any tobacco use at all. We talked about how lung cancer is treated and how to find a provider in Kalamazoo and Battle Creek areas. Thank you so much. Does anyone have any questions?